Okay. Well, good afternoon, everyone. Thanks for joining me. I am here with Elise. She is going to talk a little bit about her position and her role with us for our Nursing 824 class. So thanks, Elise, for joining me today. I'd like to start off. Would you mind just explaining a little bit about your background and your work experience and education that brought you to your position, which I'll have you explain as well, if you don't mind.
Yeah, for sure. So I have been nursing for just over 18 years now, which feels crazy to say that I have been nursing that long. I originally did my Bachelor of Nursing at the University of Calgary, and then practiced a bit in cardio medicine there, and then moved back to Victoria and did some cardiovascular surgical nursing, did my critical care through BCIT, and was working in ICU for a while, and then came to Saskatoon, and I've been in Saskatoon since 2009, and I've had sort of a varied experience since then. So came to work in trauma ICU for a number of years, had a brief stint doing some clinical research work, and then went to cardiac short stay, did the cath lab, and then nurse clinician on our cardiology medical unit here in Saskatoon. And most recently, I moved into a position of management, which has been a big step for me as of last spring. And so now I am the manager of the Cardio Sciences Outpatient Services. So that's where I'm at now. I did, should probably put it as an aside, I started my graduate studies with U of S, Masters of Nursing program in 2021 as well. So, but certainly started that and never had the intention to move into a manager role. That was, I kind of came to a spot in my career where I knew that there was something that I really wanted to invest in as far as my education with nursing. Even when I was doing my undergrad, I knew I wanted to do graduate studies, but I never knew where I wanted to focus it. I liked learning. I liked being a student. But I never knew how I wanted to focus it. And then just found myself kind of inspired one day. Actually, it was at a cardiology conference, and I was sitting in a presentation about women's heart health, and I thought, yes, this is what I want to learn more. This is what I want to be able to give to. And so that's kind of what spurred it all on. And then coming into the manager role, it really was this specific role. It wasn't about being a manager, but the Cardio Sciences Outpatient Manager role is new, and it's about creating programs, including women's heart health, but other programs like AFib, cardio-oncology, chest pain clinics, things like that. And that piece really excited me. And so it was more about the work that I was passionate about and how I ended up here.
Well, we're really excited to have you as part of the heart health team. So I'm going to just jump right into questions here. So we're learning a little bit about quality and safety and outcomes measurements and some nursing informatics this week. So I'd like to just start off with managing outcomes. And just really interesting that we've learned that changes in the care delivery are intended to optimize care. And it's usually really for patient situations rather than the nursing or the staff. And so I'm just curious if you've noticed much of this in your role thus far, and if there were any key identifiers that kind of are driving the change.
So I would say absolutely. Every month I report on specific numbers for my area, as do my colleagues in the cardiology world. And so right now, my world is quite small. Right now, it's the heart function clinic. And then we will look to add up to maybe 5 other clinics for this service. But right now, we explain, we are looking to the outcomes for our patients, and that goes to my director. My director takes it up to her executive director, and that goes up to the VP. And so all of this data that we collect goes up the ladder. And the things that I'm looking at, for instance, are how long is it taking patients to get seen in our clinic? from the time of referral to when they are seen by an actual physician. Are they meeting the goals of care? So for a heart failure patient, are they on the specific medications they need to be on? Are they on guideline-directed medical therapy? What types of patients are we seeing? Are we seeing the sickest of the sick? Are we seeing people that don't really need our care? How do we make more room for the patients that actually need the care that we are providing? And so those are all kind of questions that we're looking at as, are we meeting the needs of the patients?
Yeah, super interesting. I think that kind of fits nicely in that it really talks about, some of our readings this week really talked about a proactive approach, and where we're anticipating problems rather than being a reactive kind of society. So with the proactive approach, I guess my question is really, how have you guys been able to be proactive and identify those problems proactively?
That's tricky. I think what's been interesting about this role is I started it just as my team was coming out of working remotely, remote clinics. And so we've really come into this new post-COVID time and trying to figure that out. And so anticipating problems and trying to be proactive, I think there's a piece where you're kind of looking back and saying what worked in the past, how have things changed, and how do we need to change moving forward? How have our patient populations changed? How can we better meet their needs? And so I think a little bit of, and maybe I'm sidetracking here, but a little bit of what we've learned through COVID is things that can be done remotely, and is there benefit? Where is that benefit? And how can we carry that forward? And does that allow us to meet the needs of more people? But I think certainly in looking at creating programs, there are things that you want to try and identify as challenges or potential problems, whether it's staffing, whether it's referral processes, just in trying to make sure that the program that you are trying to design and provide gets to the right people, and that can be met. And so trying to get in front of that before launching it or rolling it out.
I think you come with a really interesting perspective in that you weren't always in the management, and so you come with the understanding of the bedside nurse and really seeing what goes on there. Do you think leaders become too complacent in identifying these problems?
I think that's a really good question, and I don't know that it's complacency. I would wonder of whether it's maybe more their priorities shift. And so I think generally leaders always want to make things better, but their priority may shift as you become maybe more removed from the reality of bedside nursing. And I think you almost need to remove yourself a little bit to have that perspective. But I think they're just sometimes there are priorities that can be. I'm trying to find the right word. Sorry.
It's only
competing priorities,
Yeah.
and so it may be perceived that isn't a priority, that there is complacency, but the energy is being spent on other things, or maybe things that are hidden. That feed into that. And so I think as a leader, you need to be in touch with the realities of the team that you are working with, and understand what their world is. But you're also responsible to understand the broader picture. So I think it's really more just about, competing priorities. But I don't think leaders have become complacent. I think maybe distracted by other things.
Fair enough. With kind of, you talked about like the collection of your data. What kind of data tools do you use, or collection tool methods do you use? And do you have any specific goals with what you are currently collecting?
Oh, do we? We do have goals. So some of our data collection is really just like we've got some spreadsheets and we are tracking our patient numbers. So we are tracking, okay, how many patients are we seeing in a clinic? How many are we seeing in a week? How many are we seeing in a month? What types of patients are we seeing? And it's really that kind of information that we are tallying in a sense. We will then create charts to present that information again to just kind of go up the ladder, and we'll have pair 2 charts that will compare the data of well, here's the number of NYHA1 heart failure patients, here's the number of NYHA2 3s, that kind of thing, or even just wait lists. So that's like an easy one to understand. So we have, coming out of COVID and coming out of that remote clinic space and back into in-person, we had a significant wait list of patients who were overdue for their visit by like 12 to 18 months. And so that's been a really valuable chart for us to be able to present that information and be able to say, okay, well, we had 175 6 months ago and now we only have 60 that are overdue. And so being able to speak to that data has been really helpful, and I think encouraging for the staff and like sharing that data and saying, hey, this is where we were and we had a lot of work to do and you guys have come here and made a lot of progress, and that's because of the hard work that you are doing. And so it's been a nice tool to kind of help encourage the staff with some of the things that we've been focusing on. So yeah, waitlist times are a big one, and certainly there's been projects that I've been like one of my big projects coming into this role was to try and assess our referral piece and take a look at the wait time for a new referral to when they are seen in clinic. And those were guided by, the timelines are guided by Canadian guidelines, Canadian Cardiology Society guidelines as to when they need to be seen. And then we would work with that to try and meet those marks. So trying to identify that timeline and then take a real good look at the problem for that with the data that we had in place of, okay, we've got this many new referrals and this many are overdue. How do we streamline that process?
Interesting. That's awesome. I could ask you questions for hours, but we'll wrap up here shortly. Do you have any advice for any, potential RN or any of my colleagues that we're going to school with here who are interested in moving from the bedside to more of a leadership role, whether it be management or something else?
I think, yes. One of the things would be to make sure that you are, I would say, passionate about the work that you're doing, because it's a hard job and it's a hard shift to go from bedside to management. It's a change in how you see things and think about things. And I think always making sure that you are there for your team, that they are the people that are doing the work for the patients that we care for. And so recognizing that it's all about the people too, really. In the end, it's about supporting those players of inpatient care to try and bring about the best outcomes. And so how do you motivate people and coach people through that? And so keeping that in the forefront of your mind would be big, and never say never. Because this was never the plan for me, but here I am.
That's awesome. Well, thank you so much, Elise.
Yeah, you're welcome.
I feel very fortunate to have spent some time with you, so thank you so much for letting me record and sharing with my colleagues.
Yeah, absolutely.